Good morning. The earthquake that struck Haiti last week has caused massive loss of life, thousands of injuries and displaced persons, and essentially crippled the country's already fragile infrastructure. On the ground, communication and transportation remain incredibly difficult. Scarcities of the bare necessities such as food, water, and fuel are everywhere. Rubble and dead bodies clog the streets, and we really still cannot accurately determine the extent of the damage. Let me show you with a couple of graphics what we do know. This is a map representing the metropolitan area of Haiti. You see the port here and the urban area here. What I'd like you to zone in on in the next slide are these colored squares. These squares are color-coded to represent damage of major buildings in the city. So those squares in red represent buildings that have been essentially destroyed. Orange represents a lesser degree of damage, but still quite significant. And these buildings represent the essential elements of the fabric of the national infrastructure of civil society. These are buildings such as banks, government offices, schools, the university, hospitals, clinics, and so on, churches. So the damage is extensive. And these conditions are posing enormous difficulties in managing the supply and distribution of the massive amounts of aid that generous people and organizations are pouring into the country. We are working with our sister organizations in the United Nations and other health agencies to remedy this situation as rapidly as possible. PAHO WHO has been designated by the United Nations, with support from its partners, to be the coordinating agency of the health sector response. PAHO is doing so from its operation bases located in Port-au-Prince, the capital, and Santo Domingo of the Dominican Republic. An operations center has also been established in Jimini along the Haitian-Dominican border. We know that before the earthquake, there were 370 health posts, 217 health centers, and 49 hospitals nationwide in Haiti, including the 11 hospitals in Port-au-Prince. The total extent of the damage in Haiti's health sector is still unknown. We know the earthquake destroyed or damaged at least 8 hospitals and health facilities in and around the capital, Port-au-Prince, and the remaining health facilities have been quickly overwhelmed by large numbers of survivors requiring a range of care, particularly for trauma injuries. Some of the hospitals that sustained damage are continuing to function, often with the help of non-governmental organizations, and field hospitals are filling the gaps to the extent possible. Israel has set up a mobile field hospital with 60-bed capacity and has been requested to serve as a referral hospital for severely injured patients with complications. A Russian hospital is now in operation, and new field hospitals are due to arrive and be set up quickly from Turkey, France, MSF, Indonesia, and the USA. The United States naval ship Comfort, with a 1,000-bed capacity, is also on its way. Health services are being provided at various health centers along the Haiti's border with the Dominican Republic. Some injured are being evacuated to Santo Domingo or to other countries such as Jamaica. Local organizations, including the Haitian Red Cross, are supporting government efforts to treat injured and the ill. Additionally, at least 13 countries from the region of the Americas are providing health relief along with the United Nations agencies and non-governmental organizations. Spain is supporting PAHO's effort with a 2.75 million sum of euros. A comprehensive assessment of the damages is underway but not yet completed. Preliminary data are being shared among all involved. Interagency health assessment teams have been started to systematically visit all health units and report to the health cluster that meets daily at the end of the day. To date, epidemiologic reports indicate that there is no increase in reportable diseases either within Haiti or along the border with the Dominican Republic. I want to reiterate that there is no risk of a communicable disease outbreak or any public health threat associated with the presence of dead bodies, which are being taken to a central location by the UN for eventual identification and follow-up with families. It is important to respect the rights of families to know that the fates of their lost ones have been ensured. Reports of dumping bodies into mass graves is disheartening. PAHO WHO is making every effort to prevent such misguided efforts. The most urgent public health threats resulting from this massive disaster include the initial emergency management of wounds and injuries. Earthquakes cause high mortality to trauma, and surgical needs are critically important in the first days and weeks. Many people have suffered multiple fractures, internal injuries, and crush syndromes requiring immediate surgery. The risk of wound infection and tetanus is also high and could disrupt health care and result from delays in treatment. From the start, PAHO WHO has mobilized our entire organization to respond. Our emergency task force has deployed 20 PAHO WHO internal staff from the America region and elsewhere in the organization's global network to Haiti. They are assisting in public health actions, mass casualty management, dead body handling, coordination, logistics, and communication. These staff members are supporting the approximately 52 members of staff already working in Haiti. In addition, in the Dominican Republic, 20 PAHO WHO staff are actively engaged. As a coordinating agency for the health cluster response, we're supporting Haiti's Minister of Health with its initial response using rapid assessment tools. We're also engaging the military to optimize the use of logistic capacities and the use of heavy equipment. There are 9,000 UN troops in country and 10,000 US soldiers are expected to be deployed and arrive. Looking at the long haul, we are working with the Haitian government and partners to embark on recovery and reconstruction efforts, assessing, rebuilding, and helping the people of Haiti on the road to recovery. By any stretch of the imagination, it's going to be incredibly difficult. The population in Haiti was already vulnerable and faced enormous health threats. The earthquake increases the risk of malnutrition, especially in vulnerable groups such as children, pregnant and lactating women, and older people. Displaced people are at risk from outbreaks of water, sanitation, and hygiene-related diseases, as well as foodborne diseases due to the reduced access of safe water and sanitation systems. We already know, based on WHO estimates, that diarrhea accounts for 16% of the under 5 mortality in Haiti. Population displacement that will result from this disaster can also lead to overcrowding in resettlement areas, raising the risk of transmission of certain communicable diseases such as measles and acute respiratory infections. Reports from the national authorities, WHO and UNICEF, indicate 58% measles vaccination coverage among children 1 year of age in Haiti prior to this disaster. Overcrowding can increase the likelihood of transmission not only of measles, but other diseases such as meningitis, waterborne, and vector-borne diseases. Haiti also has the highest incidence of tuberculosis in the Western Hemisphere, with significant incidence of co-infection with HIV. Tetanus, which has a case fatality ratio of 70 to 100% without medical treatment, is a potential risk with open wounds and contamination. Vector-borne diseases such as dengue and malaria are significant threats in the areas around Port-au-Prince, and Malaria in particular is usually low, but if we don't support the vector-borne control program, it could increase. Human rabies transmitted by dogs is a priority disease in Haiti. Leptospirosis is endemic, and infection in humans may occur indirectly when bacteria come in contact with open or exposed damaged skin. Reproductive health is another major issue. We must ensure safe deliveries and emergency obstetric care to women who are pregnant. On average, Haiti has 70,000 deliveries each year, so obstetric care and follow-up are essential services during this critical time. The Haiti earthquake continues to be an evolving tragedy, but the response has been extraordinary. We have seen President Obama, along with Presidents Bush and Clinton, uniting to raise funds for Haitian relief. We have seen individuals and nations around the world sending assistance, and the international mobilization and response has been extraordinary. Examples in our region. Brazil has sent plane loads of equipment, medical supplies, and staff. Chile sent a medical team to support the Argentine military hospital already operating on the ground. Ecuador, Peru, and others sent medical supplies. Cuba sent medical teams. Jamaica is receiving the overflow of patients into its nation's hospitals and sending several medical staff by its Coast Guard directly to Haiti. The Dominican Republic has also been receiving patients. As I mentioned, Venezuela has sent plane loads of staff and fuel, and the response from US and Canada has also been extraordinary. European countries, including the United Kingdom, France, Italy, Belgium, and Spain, in particular, have sent support. And countries as far away as Israel and China have also been involved. The list goes on and on. This represents a regional and global effort in the response, and obviously no one nation, no one agency can do this alone. Many representatives of smaller aid missions and even individuals want to join these efforts, and many of them are offering valuable skills. However, at this stage in the situation, it's important to remind ourselves that outside aid teams must be completely self-sufficient. We have all been incredibly saddened and humbled by this disaster. We must work hard to mount an effective response and help Haiti rebuild its hospitals, its infrastructure, making sure that it can withstand future disasters, which are always inevitable. In 2008, Haiti suffered the onslaught of 4 hurricanes. One of the major lessons we've learned over the years is the importance of hospitals in the aftermath of a disaster, and how to avoid hospitals becoming victims of these disasters, unable to provide their services precisely when they're needed most. This has happened in Haiti, but it can be prevented in the future. We know hospitals can be built to withstand the impact of disasters and can be planned and equipped to remain functional during disasters. We will strive to apply that important lesson to all those working in this important area of work. In ending, we fully acknowledge that financial contributions to the health response are the most effective support that people around the world can provide through reputable organizations working on the ground in Haiti. Information on donating to the Pan American Health and Education Foundation's Haiti Appeal can be found on PAHO's website at www.paho.org. Thank you again for your time and consideration.